So moving on to vaccines. As of today, we have delivered 135,585 of doses of the Pfizer vaccine across New Zealand. In the last 24 hours, we delivered 7,695 vaccinations, bringing the weekly total across the last 7 days to 34,378 people. Of those vaccines delivered to date, 43% of those have been delivered in Auckland. 19% of the people in Auckland who have had the vaccine are Māori or Pacifica. A large-scale vaccination centre is opening today in Mount Wellington, which is the second one to open up that's capable of vaccinating more than 1,000 people per day when it's operating at full capacity. Initially, that new centre is going to be used to vaccinate St John's ambulance staff and the police. It will be by appointment only initially. Many of those who they'll be targeting in the first instance are already based in Mount Wellington. Now, I know there has been a lot of interest in the vaccination program and the numbers associated with the vaccination program in particular. So I did want to give some greater detail around the first wave of the vaccination program that takes us through to the end of June. So today we're releasing a breakdown by District Health Board and by week that shows that over the next month, the next period of time leading to the end of June, so that's basically the next 12 weeks or so, we'll be delivering more than 1 million additional Pfizer doses to New Zealand's priority groups as set out in our sequencing framework. This is based on the discussions we've had with district health boards around what they are geared up to deliver. The breakdown provides a DHB by DHB number on a week-to-week basis over the next 3 months. We'll be providing weekly updates against the numbers provided in that forecast. It shows the planned vaccinations each week, and it will ultimately be the rolling total that we'll give you each Wednesday when we release the data. Media have also been invited to a more detailed briefing tomorrow to talk through any questions around the detail of that. The DHB forecast numbers show that we're on track to be well into Group 3 in our 4-group sequencing framework by the time we hit that million dose mark towards the end of June. Group 3 starts in late May and it includes our populations over the age of 65 and those across the whole population who have underlying medical conditions. What we've asked DHBs in putting these forecasts together is to be really upfront about what they think they will deliver over the next month. That way we can be sure that we're targeting areas of need or where we have any concerns, making sure that we're getting resources and vaccines into the right place at the right time and to ensure that we can continue to get a good uplift in our vaccination numbers. Moving on to our managed isolation facilities, the latest numbers that we have are that almost 88.5% of our MIQ workforce had been vaccinated as of last night. So to put those into actual numbers, 4,497 is the current number of people in the MIQ workforce. 513 of those are still to receive their first vaccine. However, I'm assured that at least a quarter of those are booked in to get their first vaccine in the next couple of days. That will take us well above the 90% mark overall for MIQ. You'll see in the breakdown that we've released today, this breaks down the MIQ workforce broadly by group, including hotel workers, public servants, security firms, and district health board staff working in MIQ. It also provides a regional breakdown of those as well. And we'll be aiming to provide a weekly update against those numbers as well so that you can see how we're tracking with that workforce. We have got some number crunching happening around the wider border workforce. That includes a much larger number of employers because it includes everything from truck drivers who may have some interaction with ships coming in and out of the port, through to people working in small businesses who operate airside at the airports. And so that work is going on at the moment to crunch those numbers down, and we'll be aiming to provide a detailed breakdown of those within the next week or so. As I've said previously, from Monday, those difficult conversations have begun with employees who have jobs on the front line who have not been vaccinated. By the end of the month, there will be nobody working in those frontline roles who hasn't had at least one dose the first dose of the vaccine. With regard to the border worker testing register, I have signed an order last night which will make it mandatory for employers to use the border worker testing register from the 27th of April. All relevant border workers continue to have an obligation to report for and undergo COVID-19 testing, and all employers have had an obligation to keep a record of this. Moving to a more standardised approach will give us better oversight of that. We've done this to further strengthen our overall border response to COVID-19. Roughly a third of employers, covering about 60% of the relevant border workforce, have been using the register to keep track of their staff's testing. Other organisations have chosen to use their own registers to comply with the testing order. The new order makes it a requirement that all of those staff in the relevant roles are now being covered by the one register. So the register notifies workers 3 days before they are due to be tested that they need to have a test. That comes through via text message. Employers are notified 2 days before a worker is required to be tested so that they can work with the employee to make sure that they are getting their testing. This means that both the workers and the employers are able to keep track of testing and make sure that the obligations set out in the required testing order are being met. The new order also captures additional groups that will need to be regularly tested as a result of the lessons that we learned from the recent Sky Chef case. You'll recall that this was a laundry worker who was being regularly tested but wasn't required to be tested. As a result of further work, we have extended the required testing order to a small number of additional workforces, and that's captured by the latest order. It also increases the frequency in which managed isolation and quarantine workers need to be tested. At the moment, those working at the jet park need to be tested weekly. Those working in other MIQ facilities need to be tested fortnightly. They will all now need to move onto a weekly testing cycle. Finally, looking to 11:59 p.m. on the 18th of April on Sunday, when the Trans-Tasman bubble opens up, we are expecting an increase in the available rooms that we have in our managed isolation facilities, and we are already seeing that. We're seeing a downturn in demand from countries other than Australia, and then obviously we're seeing people who were booked in to go into managed isolation facilities from Australia rescheduling their flights to after next Sunday, or after Sunday, so that they can avoid that on arrival in New Zealand. That is freeing up a number of rooms within MIQ. As I've said, we won't have a complete like-for-like availability swap, but there are more rooms available. And as of today, there's a good spread of rooms available over the next few months for New Zealanders looking to return home. It is a good time to take up that opportunity to come back to New Zealand. Also, those who have been affected by the current suspension of travel from India, there are rooms available for them as they look to rebook their flights, and they shouldn't have difficulty in securing rooms through MIQ to align with their new flights.